Hello everyone, I am here to demonstrate transverse section of axilla. It's little difficult to identify the structures in transverse section rather than anterior view, as here we can see all muscles are mixed up in cross section of axilla. So in the transverse section, here we can observe some nerves and vessels which are present in the middle. So here this part hints that these are the contents of axilla and along with axillary pad of fat. So we will check these contents later. First we will see the orientation of the specimen to make out which is anterior, posterior, lateral and medial aspects. So we will begin with the identification of walls of axilla. So when you see in the transverse section, there is a lateral convexity made by the chest wall. And here the chest wall is made up of upper four ribs and their intercostal muscles. So we can appreciate ribs. So we can see few ribs along with the intercostal muscles. So hence this side is the medial wall of axilla. We can also appreciate serratus anterior muscle which is along the ribs, gaining its origin. So the serratus anterior is the muscle that originates on the surface of first to 8 ribs at the side of the chest and inserts along the entire length of medial border of axilla. So entire anterior length, that is the costal surface of medial border of axilla, it inserts. So this here we can see a thin plate of bone which is like a thin white line is the scapula. So we can see here the serratus anterior muscle inserting to the medial border of scapula. So here we can see the serratus anterior is along the chest wall towards the medial border of scapula. At the lateral aspect, the lateral wall is observed as a narrow wall. So laterally we can see the shaft of humerus. So the lateral wall is observed as a narrow wall of axilla which is formed by the surgical neck of humerus, as we can appreciate bicipital groove with its contents on the tendon of long head of biceps brachii. So here is the shaft of humerus. So this designates the lateral side of axilla. And we can also observe near to the long head of tendon of biceps, there is a muscle which is formed by coracobrachialis and short head of biceps. So as these two muscles, that is the coracobrachialis and short head of biceps, originates from the tip of the coracoid process, the present section is way below the coracoid process. These two muscles do not demonstrate any bony attachments in this section. So we can see these two muscles together on the medial aspect of humerus. So medial to the shaft of humerus, you can identify the coracobrachialis and short head of biceps together. Anterior wall of axilla exhibits two muscles, pectoralis major and pectoralis minor. Pectoralis major. So pectoralis major, which makes up the whole anterior wall, and pectoralis minor is a smaller muscle which is present underneath pectoralis major. Pectoralis major originates from the rib cage, where the fibers of this muscle are towards the humerus. So here this whole muscle is pectoralis major muscle. So which is inserted to the lateral lip of the intertubercular sulcus. Pectoralis minor, which is beneath the pectoralis major, gains its origin from the rib cage. So here we can see the pectoralis minor muscle which is arising from 3 to 4 ribs. So you can see here the fibers are from the ribs and there is no contact with the humerus at all. So the fibers are not reaching the humerus, as the pectoralis minor has no attachment with the humerus and it inserts to the coracoid process, and this section is the way below the coracoid process, close to the shaft of the humerus, means close to the surgical neck of the humerus. Have a look on the posterior wall. It is much bulkier and we can observe thick coat of muscles than anterior wall. So one important point to understand anterior and posterior orientation in cross section of axilla is posterior wall is much bulkier than anterior wall. Posterior wall contributes mainly by two muscles. One is subscapularis muscle. The subscapularis muscle on the costal surface of the scapula, you can see it is present on the costal surface of the scapula, where this thick muscle originates from the subscapular fossa, and we can see the fibers are towards the humerus. So we can see here the subscapularis muscle, the fibers are towards the humerus as it inserts to the lesser tuberosity of humerus. And the second chief muscle which contributes the posterior wall is infraspinatus. So this dorsal muscle is infraspinatus. So infraspinous muscle present over the dorsal surface of the scapula. So the dorsal surface of the scapula provides attachment to two muscles. One is supraspinatus and the other is infraspinatus. Supraspinatus attaches to the supraspinous fossa and infraspinatus is from infraspinous fossa. So here the section is below the spinous process because the section is taken at the level of shaft of humerus. So it is way below the spinous process. So the muscle which is present on the dorsal side is infraspinatus. So that's how we discriminate which muscle is present on the dorsal surface of the scapula. As this section is taken below the head of the humerus, that is below the level of the spinous process of the scapula, we can confirm that the dorsal muscle is infraspinatus. Other structure related to the posterior wall is teres minor muscle. So we can see the teres minor which is along the infraspinatus. Teres minor, infraspinatus and supraspinatus, all three muscles gets inserted to the greater tuberosity of humerus. We can also observe tendon of long head of triceps present behind the shaft of the humerus. Lateral to the shaft of the humerus is deltoid muscle which is quite bulkier and well seen. Back to the contents of axilla. So in the axilla, the medial vessel is axillary vein and the lateral vessel is axillary artery. The point to note is axillary vein is medial to the axillary artery all along its course. So we can see axillary vein on the medial side and lateral one is the axillary artery. Surrounding the axillary artery, if we observe keenly, so let's enlarge to observe keenly around the axillary artery. Here we can see whitish color nerves. So surrounding the axillary artery, we can appreciate the cords or branches of brachial plexus which appears whitish in color. In this section, it is difficult to label the cords and branches of brachial plexus. We can still try to say lateral cord is here, medial cord present medial to the axillary artery, and posterior cord is present to the posterior side of axillary artery. It may be the radial nerve which is a branch of posterior cord. So at this point, it is difficult to say whether it is a cord or branches of brachial plexus. So this completes the demonstration of cross section through axilla. Thank you.